I've heard all the excuses. He never missed a dose. We never see mosquitoes. I thought my dog was safe because he's an indoor dog. And then comes the heartbreak. A pet who didn't have to die, but did. In this episode of Muddy Paws and Hairballs, my friend Dr. Zoo is back with the truth about heartworm disease. If you think heartworm prevention can wait, you need to listen to this episode. Because when it comes to heartworm, the biggest mistake you can make is thinking it's not going to happen to your pet. Hey there, and welcome to Muddy Paws and Hairballs, the podcast that tells the truth about life with pets. I'm your host, Amy Castro, and joining me today, once again, is my good friend Dr. Zoo, the owner and head veterinarian at the Family Animal Hospital of Friendswood, and the one who takes care of my pets and all the animals at Starlight Outreach and Rescue. We've worked together for years on lots of things trying to save pets, but the most frustrating has been trying to help pets with heartworm disease. And while we have lots of wins, we've also had losses, some that really still hit hard. So today we're going to break down what heartworm disease really is, how it spreads, and most importantly, how you can stop it before it's too late. Let's get into it. So, Dr. Zoo, you and I have seen the tragic outcomes and also good outcomes, but what are some of the ones that really stand out to you where you say, gosh, this was just so preventable?
Yeah. Well, I can tell you I have a personal pet story or an owned pet story and then a rescue pet story.
Okay.
And because you do expect these things with rescue dogs, that no one's cared for them, they've been on the street. But a client of mine that had brought in the cutest little German Shepherd puppy, and we got through all the puppy shots and we went through some teenager things. That pet had done so good. And then they moved and life got busy or whatever happens that they decided after some time, or maybe forgot after some time, to continue that pet that we started on heartworm prevention very young. They had stopped their heartworm prevention. So here we are. The pet is only 2.5, still a very young dog, but they come back into our clinic lives and they're like, oh, hi, we haven't seen you in a long time. Oh, yes, we haven't been on prevention for a while. We do heartworm testing, which is, in this case, was included on our blood work that we also send out. And we found that he had heartworms at a young age, at 2 years old, and it only takes 6 months for that to show up, and we'll talk about that later on for sure. But along with that blood work, it came back that his kidneys were failing as well. And at a 2-year-old, that's not a common thing we see for kidneys to be failing at 2 years. We see that a lot in senior pets. So, doing some research into, what was going on, we found out the heartworms were connected to this. So heartworms, when you have both male and female, they can create baby worms we call microfilaria, and they're literally just floating around the bloodstream, these little stringy foreign items, and the kidneys are a little net. And so they get stuck in the kidneys. And this is why at such a young age, he ended up with kidney failure. And unfortunately, we ended up having to let him go at a very young age as well. And so that was one story that, really, hurt my heart. I'm a German Shepherd lover as far as dogs go. I have 3 of my own. And to see his little young life cut off so early definitely was a sad one. And then more recent, on one of my rescue cases, a little terrier guy named Cole, he and his little friend had been running the streets for a while, and they were both young dogs, probably each less than 3. We say probably because we're guessing when they're rescue and their age. And at the rescue, he did so well, and they fed him and they got him nice and strong, and we were getting ready to do heartworm treatment on him. But one particular day, the rescue or the foster lady noticed he was not doing well and brought him in. His gums were super pale. And we found that the heartworms that usually live in the vessels around the heart had actually gotten sucked right into the heart. And he had a stage of the disease called cable syndrome. And cable syndrome, there's only really one very good cure for it, and it's an emergency cardiac surgery where they, just like in people, will put in a catheter all the way down through the veins and into the heart and pull those worms out. During that procedure, if any one single of those worms breaks, the dog can have an anaphylactic reaction and die right in the middle of that procedure. So it's not one that a lot of people want to even take a risk of putting their pet through. And then in this case with the rescue, of course, my finances are an issue. And so it was just something we couldn't do. And so we had a euthanize call for that reason as well. So cable syndrome, kidney disease, there's a lot of sequelae that can happen that can cause animals to die from heartworms, not always just a heart issue, for example.
Yeah.
Yeah. So those are some sad cases. Of course, with Cole, they rescued him as quick as they could. But if had the education been there maybe for the previous owners, maybe they would have even kept their pet and maybe had them on prevention. That wouldn't have been a deal. Or maybe, with our German Shepherd friend, Thor, I just thought we had educated, but maybe, we didn't impress it enough. So now it does stimulate me and my team to make sure, hey, this monthly prevention, you can get it as low as, $5 or $6 a month is worth it, because you don't want your dog that you're expecting to have, 10 years or more to die of too with kidney disease.
Yeah. Well, and like you mentioned, the issue that people, they start off maybe on track and then they get off track or they forget to renew it or whatever it is. And everybody has a reason for it. But can you also had mentioned that, and I don't know if you said this in the episode or if you said it before, but that they don't really live in the heart, that they live in the vessels outside the heart. Right. How do they get there?
That's a good question. So they have this very elaborate life cycle with 7 stages. I mean, quite a few stages of life, but we'll start with where they first get in contact with it, and that's a mosquito bite.
Okay. So only mosquitoes are transmitting?
Only mosquitoes can transmit them. And one thing, and we'll get to it later as we describe this, sometimes people will say, I rescued a heartworm positive dog. Is a mosquito going to bite him and then give it to the other dog? That's not how that works. Actually, the worm has to live in the mosquito from a positive dog, and then it multiplies over or changes its larval stages, that is, over several weeks before it actually will become infectious. And most of the time, if a mosquito is, let's say, in your home or whatever, it's going to die before then. Or let's say a mosquito bites a dog from the outside world, it's going to go somewhere else. It's not going to usually come back and bite this other pet. That being said, it's not like an instantaneous bites one and then injects it.
Yeah, like a vampire bite.
Like a vampire.
Suddenly you're a vampire.
Yeah. So once that mosquito gives a certain larval stage, that little baby worm gets injected into the animal's muscle or skin tissue. It takes 6 months of it migrating throughout the body before it actually becomes an adult worm that lives in the heart or around the heart. The pulmonary vessels, arteries, and veins around the heart is a perfect place for these worms to get their food, which is your pet's blood, for one. And then, of course, what's in the serum in that blood can be things like oxygen and carrying that sort of thing, as well as proteins. And it absorbs all those things. And if it meets its boyfriend or girlfriend or husband or wife in there, then if you have one male and female, to actually start making another kind of larval stage called the microfilaria. Those become a certain stage. That's when a mosquito can potentially bite a dog and pick it up from a dog. And then later on, it'll go through several stages inside the mosquito. Weeks later.
But the whole time that's happening, you're oblivious. You're kind of at risk all the time.
Yeah, you see no signs of it. And I think we do hear lots of people say, he doesn't go out much, or we'll get to that.
Yeah, we're going to get to the BS reasons people have.
Of course, we just always want to put ourselves in the most positive situation or positive light, and we make an excuse essentially. But if we're really logical about it, we'll figure out that it's not the way to bury your head in the sand. It's better to be aware and go, okay, look, I can skip Starbucks this month, and I can definitely have my heartworm prevention instead.
Yeah, exactly.
Yeah. So adult worms live mostly in the vessels near and around the heart. The microfilaria, or the other larval stages, are migrating through the muscle tissues. And again, they can migrate through the kidneys. They can migrate into the liver. Anywhere your blood flows, the microfilaria will flow through too. So we'll see sometimes changes in those other organs as well. So it can cause multi-organ failures.
Yeah. So what are usually the first, other than a positive test, let's say somebody didn't test their pet, what's the progression of the disease in the animal?
That's a good question. It starts off with just like this little hacking cough. Sounds like they're clearing their throat, and we might just say, he drank his water too fast, or he was pulling on the leash, or it's allergy season, or, maybe he got a little kennel cough or something like that. But then it's just persistent. Maybe months or years, it might just be this little annoyed little cough going on, or
really, it can go on that long.
It can go on that long. And then, depending on how many worms they get, like, for example, a cat can get heartworms too.
Yeah, I want to definitely hit on that.
They might only get 2, 3, 4 heartworms, but they're a little tiny body. That's a huge load for them. A big dog might get 2, 3, or 4 heartworms, and then let's say they move, somewhere where there's not many mosquitoes, they stop getting new worms, let's say, but they'll still have an almost like an allergic reaction to it. That's what causes that cough. The lung tissue itself gets swollen and inflamed and angry, and that's where we get this little irritated cough. But dogs can easily have 50, 100 heartworms and
Wow.
clog up those vessels, and then pieces of lung can be dying, and we've seen it all, that's for sure. So at first it's a little insidious cough, and then the most common thing after that is true heart failure, because the blood circulation really depends on how much pressure is in that circulatory system. Your heart is a pump, and of course all the pipes going in and out of that need to be clean and clear, just like our sewage system. If it gets clogged, it's going to back up. That can happen. If it backs up in the wrong place, you can get fluid in your lungs. If your blood backs up in the wrong place, you can get fluid in your abdomen, or really because your liver starts to leak fluid out of it. Again, we talked about how the worms can get in there. And so sometimes people will come in with their dogs at the later stages in true heart failure, congestive heart failure, we call that. Or then sometimes we see these other weird sequelae, not weird, but unfortunately side effects of the microfilaria, like the kidney disease or the heart cable syndrome, where it's very sudden instead of like a slow insidious change. But it can be dormant looking, or you may not pick up on it for years that a dog has heartworms. And the earliest that a test can show up is 6 months. And again, we talked about how when the mosquito first bites, it takes 6 months for that worm to go through. Let's say it bites and somehow, and this has happened, it only has male worms. The test tests for a certain female hormone. So I've had dogs test negative, and we're still suspicious of heartworms. They have maybe signs of this cough or heartworm disease, or maybe we take an x-ray and we see the heart is misshapen. That can indicate heartworm disease. But the test is coming up negative. Sometimes the reason is because it's just male worms.
Now, will it come up? Because one of the things that I hear people, make excuses, or they don't do the annual test. Oh, do I really need to do this every year? Like, to me, that is a good reason to do it every year.
That's
because would it catch it the next year?
Eventually, especially if we don't for some reason put them on heartworm prevention, they might catch it the next year, or maybe one of the babies that was still developing and hadn't fully developed yet was female, then it would show up. There are other ways that we can find it, an echo or a heart ultrasound in certain cases. And then there's another interesting phenomenon where a dog can be negative because their own body has created antibodies to try to combat the worms, although unfortunately it doesn't do much for getting rid of the worms. But what it ends up doing is it gets in the way of the test, and it can block the test. And so you can get a negative from that, and there's another special test you can send out to the laboratory to confirm whether or not, it quacks like a duck, it sounds like a duck, it's probably heartworms, but for some reason my in-house test isn't working. Let me send it off to the laboratory. Another reason why it's important about testing every year is we do have resistant heartworms coming up, that they're resistant to heartworm prevention.
It seems to be the way with all kind of disease.
Fungal, everything is getting tougher to combat, and the world is trying to kill us.
Apparently. It's a dangerous world out there, people.
It's a dangerous world. And so, especially from the Mississippi Valley and that area, we've been seeing this population of heartworms that is resistant to some of our good old-fashioned heartworm preventions. HeartGuard, very popular brand, has been around a long time. We're seeing some resistance to that particular ingredient from those areas. And with the way our world, we travel with our pets. We're spreading it around. Eventually, it's good. And rescue, we do send animals all over the place nowadays. You yourself have traveled to the East Coast with one before.
Well, I remember growing up on the East Coast, and when I worked at a vet all through high school and college, it was like heartworm prevention was given seasonally. Like you started in the spring and you stopped in the fall and winter. And it's like, I remember, I don't know if it was you that said this. I think it was you that told me it's not a matter of if your dog is going to get infected with it, it's just a matter of when. Because especially here in Texas, and depending upon where you are listening in the world, there's probably a gazillion mosquitoes floating around with it. And so your dog is going to get injected with it, basically.
Absolutely. It's spreading around the world, and it's a very safe and easy preventative. So I do think it's worth covering them for that risk. Plus, you're going to cover other things, which we'll probably get to later on too, with a prevention. An interesting thing we learned about in vet school was a population of seals out of California were bringing heartworms back and forth from Alaska to California, because I think in California, they're kind of iffy about heartworm prevention.
Because it's so dry.
It's so dry, but there are certain pockets where they could get exposed. So.
Yeah. And I didn't realize, I mean, obviously the whole thing about cats getting it is relatively recent. I mean, that wasn't a thing back in my
We didn't push prevention, honestly, because I think we had a hard time proving it to owners or anybody else whether their cat had gotten it. And still, testing cats for heartworms is very hard.
Yeah.
Still.
So it's not the same testing process.
It's a similar kind of test, but because they might only have 1, 2, or 3, they're more likely to have a single sex infection, like just an all male infection. So we get a lot of false negatives. Yeah. So honestly, most of the time when we actually find out a cat has heartworms, they've already started to have heart disease, and it's awful. And so then we're working backwards, like, okay, now we have heart disease. Could it be because of a heartworm? And let's find out. And then maybe we're doing echoes or ultrasounds if the heartworm test itself doesn't come up, or the special heartworm test that we send to the lab. They do is basically they alter the temperature and denature the proteins, and so the test is a little more sensitive when we send it to the lab. Yeah. So for cats, honestly, without a heartworm test, I will have cats on heartworm prevention 24/7. Or basically every month of the rest of their lives, just as a precautionary thing. And as you know, things like Revolution, that's a very popular brand, have flea prevention, tick prevention, ear mite prevention in them, and heartworm prevention. Yeah. And intestinal worm prevention, which cats, I'm going to eat your dirt out of your plant pot. No, I don't go outside, but I'm going to eat that. So they can pick up parasites through there. So you're kind of covering everything with Revolution. Yeah.
And that's good to know. So I want to talk about the expense, because that's one of the myths. But all of these things that you're talking about, once an animal has it, that's a lot that you're putting your animal through. A lot of procedures, a lot of testing.
Don't always work out.
Yeah, a lot of money. And it could be prevented with a monthly pill, or every 6 months shot, or a topical or something.
Yeah. Oh yeah, and dogs too won't take pills sometimes, so they have topicals for dogs. And so you can do. Now, we even have a shot that lasts 6 months or a year, depending on what life is conducive to, Yeah. Or because, let's say you're a mom with 3 kids. Are you going to remember to give that monthly pill or chew every month? Maybe not. So maybe
barely remember to pick up your kids from school, for God's sake.
Oh, yeah, I have children and offspring. So maybe consider the shot or ask your doctor for that sort of thing. Yeah. So there's a lot of ways to work around what we call compliance, the study of whether or not people are actually able to give medicines that are recommended or required for keeping their pet healthy. So the good thing is, if you want to be competitive or relevant in business, you have to come up with a new method that's better to get people to be able to do that in a conducive way. So the shot, the topicals, the chews, the pills, there's lots of ways to do it. So.
It's kind of like me with flossing my teeth. I'm terrible about flossing my teeth, but I'll use those little flossy sticks.
They're so much easier. I agree. And you can keep them in your purse, and you can do it right after you eat. Yeah, exactly. So I'm on the same boat as you.
Convenience is definitely good. Well, and not only all of what you're putting yourself through, but you talked about those 2 animals that died, and obviously you were able to humanely euthanize. But let's, if somebody needs any more motivation, and we're going to do some myth busting, but tell us what the death is like. It's because I know it's bad, and it's really bad suffering.
Yes. Congestive heart failure. I hate to use this analogy, but it's probably the truest thing, and I do use it when I need to explain to owners. You're drowning in your own fluids. Essentially, if your blood can't flow because the worms are blocking your blood flow, that blood, or the little sort of the filtrate of it called plasma, will build up in your lungs in particular, and your lungs are like a sponge, and they just want to hold on to fluid. So if anyone has experience like pneumonias or, COVID, of course, and that sort of thing, if you just have, 10, 15, 20% bad lung, that feels awful. Mm-hmm. But when all your lung is affected with fluid, if it was a person, they would probably think I would rather die. If it's an animal, they don't know how to deal with that. So sometimes we have to step in to help them. Yeah. Certainly.
So basically, we're allowing our pet to slowly drown and suffer. So
we don't want
excuse for that.
Nobody wants
terrible.
That. Yeah,
it's terrible.
And we don't want to hide our head in the sand for that, because then let's say they do pass or we put them down, then there's years of regrets after that. And that's a whole. You need to start the psychological therapy session type of.
I just did an episode on grief, but but most of this episode on grief that we did was. You did everything you could, and you still felt like shit.
Yes.
Well, how about if you realize it is really your fault?
Yeah.
I hate to say that. I hate to be the ugly person,
but we all make mistakes, and we should learn from them. But this is your chance to learn before your pet ever has to even experience anything like this. Yeah. We don't want that for your pet, for sure.
So let's talk about the myths.
You don't want that for your pet.
Yeah, for sure. So I went out to and I stole some of these from the American Heartworm Society,
That's
which I am.
a wonderful website.
Yeah, and I'm going to put that link to that website because if you want to know anything about heartworms, they've got infographics and all kinds of information.
I was going to tell you, there's a really very in-depth, like if you want to nerd out on it video, but they make it very entertaining. It's, of course, it's a cartoon on YouTube that kind of goes off of AAHA's thing as well. So I'll send that to you if you want to link it.
Yeah,
it's
okay. Put that in there. So some of the myths that people believe, which, so it's not just I'm intentionally neglecting my pet, but I didn't think it could happen because, and I want you to kind of bust some of these myths. So one of them is, like the example that you gave, it was on prevention. I skipped a month and suddenly my animal's got heartworm. He's never missed a dose.
Yeah, that's a tough one. Yeah, for sure. The way these work is that they reach back for usually 30 days if you're doing like a pill or a chew. So if you miss a month, you don't get that reach back of killing whatever was in the system that got infected in the last 30 days. Also, once the mosquito bites this particular larva stage, the heartworm preventions only kill the 1 or 2 of those. But then it'll start to change again to the next larval stage. And even though it's not in the heart yet, again, the heartworm prevention won't be able to kill it because it's past the stage of where.
So you got to kind of continually
You have to give it continuously at the 30-day mark if it's that kind of product. Again, that's why the injections can be super helpful because people do get busy, forget, miss a month or whatever it might be. And then again, the test takes 6 months for it to show up. So let's say in that 1 month that you missed, the mosquito did bite and inject a heartworm and it got past where you couldn't treat it with the next dose. You won't know for 6 months if you even know at the 6-month mark, because maybe his annual vaccine visit to the vet doesn't fall where that is, or maybe you don't go that year or whatever, which you should, but things like that happen. And so then those worms have a chance to become multiple and large and start to block blood flow around the heart.
Yeah. I know we would never have this excuse in Texas, but we didn't see any mosquitoes, so we didn't think we needed to.
But I know you have out-of-state listeners, so
out of the country. I mean, we got people all over the world.
I love that. Which that is an excuse. And the thing is that, are you really on guard watching for every mosquito to come through your house or your window? No, of course not. My most dreaded of all, and it's probably one of your myth buster things, the indoor only one, I think.
Oh yeah, that was my next one.
That's the best next one, because in an exam room, often I have to tell the story to people. I'm like, oh, he's indoor only all the time. Okay, well, have you ever laid in bed and heard that buzzing noise? That mosquito comes and you're slapping your face and you're slapping everything, trying to kill the mosquito in the middle of the night. It happens to your dog and cat too. And it happens more to your dog and cat because they have a little heat-seeking device. And they're going to find them before they're going to find you.
Good targets.
So yeah, they're the perfect target. And usually when the pet is sleeping, they're very, very still. So a mosquito can bite right through that unhaired area around the nose and on the ear pinna. It's the easiest target. Although they can find their way through skin because that's how they survived millennia,
Yeah, exactly.
Since dinosaur ages. Because
they lasted longer than the dinosaurs, right?
Yes. Exactly.
Yeah, so that's, again, bad excuse. We live in the city. We don't live in the country. There's mosquitoes in the city. I mean,
anywhere standing water can be, obviously, is where mosquitoes can multiply. You know this, I'm sure, and this, luckily, the cities know this too, so that a lot of times the cities will offer different kind of mosquito control programs, but no one's coming to your house to do mosquito control programs. So you leave that one plant pot out because you potted your other plants and you left it out and the rain collected, you're going to have a nice little batch of mosquitoes come up.
Yeah.
Very shortly, within a couple of weeks.
Yeah. And it only takes one.
Yes, it does.
What about the skipping in the winter? I mean, that's a lot of people think they can still do that.
Definitely not in our area. And again, because of the way that animals have traveled as much as we have traveled around the world, there's quite a risk. So if it's my pet, I would definitely keep them all year round. You may find that certain veterinarians in certain pockets may advise that, but definitely talk to your vet about that because they know what the prevalence is in their area. But even Alaska, for example, they get tons of mosquitoes in the summertime. And so they're the coldest ones that I could think of out there.
Yeah,
they're going to need heart prevention. Yeah.
Okay. What about natural? There's some people that believe they've got, someone told them on Facebook or they read it. They saw a TikTok video where somebody said, spray your dog with, whatever. Yeah.
Citronella. I've seen it all, I've seen it all. Unfortunately, what happens with natural things in particular is that they're very low cost or expense. And I think there's an attraction kind of subconscious to that. And then also because they're not making huge profits with some natural things. I don't think they don't do studies on those things really very well. And so a lot of it's anecdotal, or, my grandma
Just because
in Italy,
or just because your dog didn't get harmed, because I've had people tell us that too in rescue. They're like, we will deny you for adoption if your animal's not on prevention.
Right.
And it's like, well, I'll go get it tested. Oh, it was negative.
Yes.
So it's like, no, it's kind of like
it's Russian roulette.
Exactly. You're playing Russian roulette.
Yeah.
It's just like saying, I've never worn my seatbelt and I'm not dead yet.
Correct.
But yet all the people that we know
Exactly.
are.
Yes. Unfortunately, that's
non-logic.
It's not logical. It's just really an excuse to say, oh, this is okay and I don't want to change.
Yeah.
But the reality is that, yes, those natural ones don't work, or they're not proven to work. And, why take that risk when there's very safe prescription type options for that sort of thing? Yeah.
Well, and that along those lines, you mentioned that people will use those because it's cheaper. I mean, it's cheaper for me to buy a little thing of cinnamon than the heartworm thing.
Exactly.
Well, or people that will say heartworm prevention is too expensive. Let's talk about the cost of prevention versus treatment. And we already talked about the suffering cost for your pet.
Yeah.
But let's
can't put a dollar on that.
Yeah, exactly. But
prevention has gotten, just like all other products that are out in the world, medication wise, there's a lot of generics out there. The studies were done on the ingredients in those generics, so we know that they're going to work. Before coming on, I just went onto all the popular pet medical websites where you can order your prescriptions. And for a small dog, like less than 25 pounds, you can easily order something in the $28 to $30 range for 6 months of protection. So that's $5 or $6 a pill.
Yeah, that's no excuse right there.
And I spent more at Starbucks on my white chocolate mocha, venti, whatever. So there
can't get anything out and about.
Do I need those empty calories versus saving my pet's life? Probably not. I probably should just go ahead and get the generic heartworm prevention, which actually the one that I looked at did include intestinal prevention, worm prevention as well. So 2 for 1. And then I looked up one, again, a generic one. I just looked for the lowest cost that I knew would be effective for a 50 to 100 pound dog. And it was like $6 or $7 per month per pill. So really very affordable. Don't go to McDonald's that month one time and you'll be fine, and probably you'll save your own life.
Yeah.
Having a heart attack from their Big Mac.
Save your pet and
So, I mean, cost-wise, there's not an excuse, there really isn't. And there's so many resources out for people who may be like going to the vet, getting the heartworm test and exam. Maybe that adds to cost. And I realize that that's important. You have to calculate those things. And of course, I'm a vet, so I'm going to promote that you should go to your vet and get a good complete exam for other reasons. But if it's like not doing it at all, then there are plenty of outreach programs. We have here the Apparently Animal Resource Center. We have the Animal Alliance. We have SNAP and SNP and Emancipate. There's so many places where you can get a heartworm test and a prescription for heartworm medicines for very, very low cost.
Yeah, and it doesn't have to turn into a full-blown.
It doesn't have to. Yeah. For me, I love animals. I want to advocate for them. If you're not coming to me as a vet, and you need to go to a resource center, I'd rather you go there because I want your pet to have the protection that it needs. And it doesn't take much really cost-wise. It might take some of your time, but again, that, it's worth it if you want your pet to be around for the long expectancy of its life.
Yeah.
Because heartworms will definitely cut that short.
Yeah. So what about people that say, I'm not going to bother with the expense now. I'll just treat it when they get it, if they get it.
Yeah.
Let's talk about how much that, not even just the monetary cost.
Although that stimulates our decisions a lot, so we have to talk about that.
Yeah, let's talk about that, but then also talk about the process, because I don't think people realize it's not just I go in, I get a pill, and it fixes it.
That's right, exactly. It is a 2 to 6 month treatment, depending on which way you go with that. And as long as those worms are in there, they're creating damage. We just talked about how it takes at least 6 months to discover it's even there. So they're in there damaging the pet for 6 months. Then let's say if you even got it tested right away and decided to treat it right away, then you're adding 2 to 6 more months of those worms being present and damaging your pet's heart, kidneys, liver, all those things. Yeah. And then let's say, and this has happened many a time, I've treated a dog for heartworms. Maybe they were age 3, 4. We got rid of the heartworms. They learned their lesson. They kept their pet on heartworm prevention. But at age 7, 8, 9, their dog goes into heart failure anyways.
Because the damage has been done.
Damage has been done. And that is the saddest because they have their regrets. They have already decided, I'm never going to make that mistake again. but it will sometimes those consequences still follow us.
Yeah.
Yeah. We don't want that. Definitely prevention is much better. Cost wise, easily $1,000 to $2,000 or so here in our area. But certainly if you're up on the East Coast, I've seen $5,000, $6,000 estimates.
Yeah.
If it's a very serious case where they're already in heart failure and they're going to need things like heart medicines the rest of their lives or follow-ups with a cardiologist or a specialist, I mean, that can go way higher than 5,000 or 6,000. So cost-wise, definitely not the way to go.
Yeah.
Versus, your $5 or $6 or $7 a month minimum. If you get the fancier stuff that has like flea and tick prevention and ear mite prevention in it, great. I mean, yes, you're going to pay more, but fleas, ticks, and those sort of things bring germs to people too that can be deadly from
like Lyme disease,
fever, Lyme disease, absolutely. So yeah, there's a lot of benefits for people too when your pet is on heartworm prevention. Usually, it's going to be all encompassing. Hookworms and roundworms, actually, the intestinal parasites are also contagious to people, unfortunately.
Yeah.
So again, double benefit, for you, for your pet. If you got kids, I mean, definitely want to consider something like that.
Yeah.
And so cost wise, definitely worth it to prevent versus treat.
Yeah.
Sure. Yeah.
And then the process of treatment, like I know we've gone through that several times with rescue pets. I don't think people realize that, well, why don't you just go ahead and go through the shot, the leash walking, the cage rest. It's a process.
2 to 4 weeks. Yeah. So once you decide, okay, I'm going to treat this pet, first, they have to be on an antibiotic for 30 days. That weakens the worms. Then after that, we decide at that 30-day mark, we're going to run some tests. Like, let's make sure your heart is fine. Make sure your kidneys or liver are fine before we basically give a worm-killing injection into the lower back muscles, absorbs into the pet. And that's not done at day 60. So it's 30 days of antibiotics, 30 days of making sure the animal does well after the antibiotic and doing those important tests. First injection happens at the 60-day mark. 30 days from that, we'll do a second and third injection back to back. So you'll have a total of 3 injections. Every time we do these injections, it's 2 to 4 weeks of very strict cage rest because you're killing these worms. They're loosening from these vessels and they could likely get stuck in other important places, not to mention the lung, but also the heart, the kidneys and liver. We've talked about that. But basically when they're dead, they're more likely to be floating around and getting stuck. So if your pet gets overexcited, and who's not going to get excited when mom comes home from work and that sort of thing. They can literally dislodge a piece of worm and have a stroke and die. They can have basically a heart attack, you could say. They could definitely clog up the liver or kidney, something like that. So we offer sedatives. You're giving your pets pills 2 to 3 times a day, not only just to keep them calm, but to reduce the side effects of those pieces of dead worm floating around in the system.
Yeah.
And then you have to still wait 6 months from that to know if this treatment was successful. You have to test them 6 months later. Now, the good news is that the treatments are pretty effective. Yes, there might be some side effects. Definitely better than the way old school we used to use the arsenic-based products. No, we don't do that anymore. But, just the fact that the worms are dying and chunks of worms are floating around the body is very risky still, too. So, yeah, especially because we do discover this in young dogs. So they're a 2 or 3-year-old. They want to bounce off the wall, and you have to, no, stay calm. 2 to 4 weeks, get in a crate, in a kennel.
And just so everybody hears that, I mean, we're talking about your dog is in that crate like 24/7. You open the crate, you put a leash on, you walk it slowly outside, you let it pee in the grass, you turn around, you put it back in the cage. No jumping on the sofa, no jumping on the bed, no running around the house with anybody else. I mean, it's a nightmare. It's a lifestyle change. And and to the fact that you're now going to have to sedate your pet because you're going to have to stick it in a box.
Yeah. Because you don't want it to possibly die of a stroke instantly.
So it's quite an ordeal for your family, for your pet, and then, add the expense and the long-term damage. I mean, it's just ridiculous to put yourself through that.
Definitely prevention is, let's say an ounce of prevention is worth a pound of cure in this case, for sure.
So I would hope that by now, anybody that's listening to this episode or watching this episode is fully convinced and has no doubt whatsoever that this is the way to go with their pet. Just prevent the heartworms, give the monthly or the annual shot, whatever it might be. Yeah. So if there's just one kind of final thought, or if you got a couple final thoughts that you want to leave people with about heartworm prevention, because it is Heartworm Prevention Month, or at least Heartworm Awareness Month.
Heartworm Awareness.
The month of April.
It's both. It is both. And the reason is because this is where we're really getting a mosquito outbreak. So this is the time where they're going to be more likely to catch it. Although, as you know, in Texas, it's like all year round. I mean, I can tell you for sure in January I was bitten by a mosquito here in Texas. So.
I'm already seeing them already. And it's funny that we're recording this today because when we're done in about an hour or so, I've got a mosquito prevention person coming. I don't want to kill all the bugs in the yard.
Right.
But the mosquitoes were admitting this on the air. The mosquitoes were so bad last year, I used to wear my bee suit when I would go out to mow because they eat me up. I must put up a lot of
you're right. They're heat seekers. Exactly. Well, if you're mowing and getting all sweaty, no doubt about that. Yeah, I mean, I think the key takeaways we talked about, but I'm just going to summarize them.
Yeah.
It's not that expensive. There's ways to get it and appropriate ways. It includes testing every year as well as at least getting one of the generic formats. And that prevention is definitely better than having to treat. So an ounce of prevention is worth a pound of cure.
Yeah.
And we want your pet to live a long, healthy life. That cats and dogs are prone to that. And for cats.
And seals.
And seals.
I didn't realize other animals got it.
Big cats too. Yeah. Tigers and lions, they keep them
You got a tiger.
If you work in a zoo, you're probably using heartworm prevention. Yeah. Wow. It's pretty neat. Yeah. I got a consult with a few at the Houston Zoo about that. And they're like, oh, yes, prevention everywhere. Because we were talking about another case. But anyway, that being said, that was my first question. They're like, oh, yeah, that's every month for sure. Yeah, they're on it. So they probably use ProHeart now, the shot that lasts.
Might be easier.
For a tiger or a lion, probably so. Yeah, probably so.
Can't just put it in peanut butter.
Right. There goes my arm. I could only imagine. Yeah.
Wow. Well, like I said, I hope that people are fully convinced at this point. I will be admitting right now, which I hate to admit, I've never given my cats because I've kind of done the it's indoors thing, but I think now I'm going to change that whole philosophy.
And there's a generic version, especially when you do rescue. I know the cats multiply in your life. So yeah, absolutely. There's generics now of those things. Yeah, definitely recommend it. Yeah.
Okay.
You'll hit all the benefits with it.
Well, Dr. Sue, once again, I appreciate you being here on the show to share this.
It's always so fun to be here.
I know. We have a good time, but I think it's just such an important message. And when I saw it pop up on my calendar that it's, like I said, Heartworm Awareness Month, I thought, who can I get to come on the show at the last minute to come help me out?
Anytime, especially for heartworm disease. That's a big one. Yeah, we see it a lot around here.
Well, I appreciate it.
Yes, ma'am.
All right.
Thank you. Thanks, guys.
Yeah, thanks for listening to another episode of Muddy Paws and Hairballs, and we will see you next week. Thanks for listening to Muddy Paws and Hairballs. Be sure to visit our website at muddypawsandhairballs.com for more resources, and be sure to follow this podcast on your favorite podcast app so you'll never miss a show. And hey, if you like this show, text someone right now and say, I've got a podcast recommendation. You need to check the show out, and tell them to listen and let you know what they think. Don't forget to tune in next week and every week for a brand new episode. And if you don't do anything else this week, give your pets a big hug from us.